All right, listen up. You are absolutely going to see this on your NCLEX. Today, we're going to master fluid volume deficit so you can knock those questions out of the park. Let's get into it.
Okay, here it is, the classic scenario. Your patient's heart is racing, their blood pressure drops when they stand up, the clock is ticking, your brain should immediately scream fluid volume deficit. Let's break down exactly what you need to do. So here's our game plan. First, we're going to get the why, the hormones running the show. Then we'll nail down the what this deficit actually is. And finally, the how, your nursing action plan, all wrapped up with a super high-yield recap to make sure it sticks. Okay, so first things first. Before you can fix the problem, you gotta understand how the system is supposed to work. And when it comes to fluid balance, there are two big shot hormones you absolutely have to know.
Let's make this super simple. Think of it like this. Aldosterone saves salt, and water just kind of tags along. But ADH, it's all about saving just the water. You've got to burn this difference into your brain. It's so important. So when your body senses that blood volume is getting low, it basically hits the panic button. That's the RAS system. The end result, aldosterone gets released and tells the kidneys, hey, hold on to sodium. And we all know, wherever sodium goes, water follows. Boom, blood volume goes up. Now, ADH is a whole different story. Its trigger is when your blood gets too concentrated, too salty. The pituitary gland sends out ADH, and it acts like a bouncer at the kidney nightclub, telling water, nope, you can't leave. That means you pee less and more water stays in your body. And we love a good mnemonic, right? This one is pure gold for exam day. Just think, anti-diuretic hormone, the D is for decreases urine output. Lock it in. It's a free point, I'm telling you.
All right, we've got the hormones down. So now, let's get to the main event. What in the world is actually happening during a fluid volume deficit?
Now, this is so important. FVD is not just dehydration. It's not just about being thirsty. You are losing both salt and water. That means the volume is literally disappearing from your blood vessels. And that, my friends, is why it's such a big deal.
These are your classic NCLEX triggers right here. Think about it. Hemorrhage, severe burns, tons of vomiting. Any situation where you're losing that salt and water combo can lead straight to FVD. You've got to know these cold.
So this is what you're going to see at the bedside. The patient's heart is hammering away, that's tachycardia, trying to make up for the low volume. Their blood pressure is tanking, that's hypotension. You pinch their skin, and it stays tented. Their mouth is dry as a desert. These are the telltale signs.
Okay, you've connected the dots. You've identified the problem. Now what's your first move as the nurse? What are you going to do to pull your patient back from the brink? Your number one priority is to fill that empty tank. And for that, you need an isotonic fluid. We're talking 0.9% normal saline or lactated ringers. Why? Because they have the same concentration as our blood, so they stay right inside the blood vessels to boost that volume. This is your first and best move. So how do you know if what you're doing is actually working? You watch the pee. Yep, the urine output. 30 to 50 millimeters per hour is your magic number. If you hit that range, it means the kidneys are getting what they need and you are winning. Okay, everybody lean in because this is a massive clinical pearl. Forget all the fancy gadgets for a second. The single best indicator of your patient's fluid status is a daily weight. Same time, same scale, same amount of clothes. This is non-negotiable for anyone with a fluid issue. All right, let's bring it all home. We're going to boil all this down into one super simple pathway that you can take with you straight to the NCLEX. It's a simple 3-step dance. Number 1, recognize the signs. Number 2, intervene with the right fluid, isotonic. And number 3, monitor that daily weight and urine output to make sure they're getting better. Recognize, intervene, monitor. Got it? And that's it. That's your lightning fast review of fluid volume deficit. If you master this pathway, you're just one step closer to crushing your boards. For more daily tips like this, make sure you follow. But wait, don't go anywhere. To really know a concept, you have to know its opposite. So I've got a challenge for you. Now that you're a pro at spotting fluid volume deficit,